Hey guys, today we have another genetic counselor interview. Today it's with a practicing genetic counselor, Amy Kunz, instead of a genetic counseling student like the last video, but I think you're going to get a lot out of it and I hope you enjoy. All right. So to start off, would you mind giving a little background on your education?
Yeah, so I started out getting my undergraduate degree in biology up at Allegheny College, which is a small liberal arts school in the north of Pennsylvania. Um, and then following that, I took some time to try to figure out what I wanted to do with my biology degree, maybe research. And then I took some time to work in a laboratory. Um, Following that, I decided I wanted to pursue genetic counseling, and so I got my degree at the University of Pittsburgh, graduating in 2016.
Awesome. So would you mind sharing some of the about the specialization you ended up choosing for genetic counseling and how you got into
Yeah,
that?
yeah, absolutely. So when I first started exploring genetic counseling, I was working in a lab that dealt with pediatric metabolic conditions. So that was sort of what my background was. Um, I did like pediatric genetics as well. And as I did my rotations through the graduate program, I kept a very open mind. I was surprised at how much I liked all of the other kind of subspecialties. And I ultimately decided to go with a job in cancer genetics, where I've now been for 5 years. I really just enjoyed um, the patient population. I feel like they're a very motivated set of families and patients who are really trying to get to the answer for why they've had certain family histories or why they personally have been diagnosed with cancer. So I like being able to participate on a team of other providers, other doctors, oncologists, to really help get some answers for these people and help them to make a plan moving forward.
That's great. It's really awesome that it kind of came into based on the way you had the patient interactions. I'm sure with a job like this where you are having sensitive conversations with patients, the one that's going to give you the best feeling is going to definitely be where you want to specialize. So that's really great.
Yes. Yeah, I did feel like I got to try out all of the specialties here in Pittsburgh. And I just felt like where I ended up was the best fit for me.
That's awesome. That reminds me. So at Pitt, the I don't know if it was the same way when you were a student because I just spoke to a current Pitt genetic counseling student yesterday actually, and she told me that the program currently is where you do most of your coursework on the front end and then you do the rotations. Is that how it was when you did it?
Yes. So the first year was primarily in the classroom, taking tests, studying, writing papers, kind of what you traditionally think of as schooling. And the second year was really immersive. You're spending full days at the clinics from beginning to end, and which I think is great because it allows you to kind of follow a patient or follow a case and work in a setting just like you were a full-time genetic counselor.
Okay, I'm curious what if you applied to other genetic counseling programs that had a different way they split that up because I know a lot of them do vary, and I'm wondering if you think that ended up working out better for you as opposed to some of them that throw you right into it or they kind of intersperse it differently.
Right. So I am probably a little bit of a minority of a person. I only applied to Pitt when I was going to school, and that was primarily just location based. I was currently living in Pittsburgh, and my husband's family was in Pittsburgh, so I wasn't looking to move if I didn't quite have to yet. And so I just got very lucky in that the place that I applied ended up accepting me. So I don't have much to compare it to, but talking with other classes, other students who train elsewhere, I do feel like Pitt allows you to see a lot of cases with the way it's set up. I know we were very routinely seeing 150, 200 cases in our second year. So I just think with being at clinic throughout the day, you just have the opportunity to just fit more in one day.
That's great. That's really awesome that you just applied here and that worked out so well for you. That's great.
Mhm. Yeah, I got very lucky. It did take a couple tries. I would say I was definitely someone who did not get in my first year. but I, thankfully did get in my second attempt.
Okay. Would you mind speaking to what you did in that interim that might have helped your second attempt go better?
Yeah, so I think just time, honestly, just getting more years of experience in both counseling. So I took time to participate on a domestic violence hotline. So just getting more experience doing that. Also getting some more shadowing experience, working on just also my understanding of the field. I think that was able to be reflected in the types of questions I asked my interviewers during my interviews. I think, yeah, it was just like the right combination of just learning how to be a better interviewer and just having a better understanding of the field, and then learning how to convey that in my interviews.
That's great advice. I know it's very common since it's so selective and there's such small cohorts that happens to a lot of people. So that's
Mhm.
really good to keep in mind.
Right. Yeah, I definitely don't think people should be discouraged after their first attempt. I think I would say half of my class were people who were waitlisted or didn't get in on their first attempt. So it is quite common. I think it just speaks to the number of really good applicants that are out there and just the few spots that there are, rather than one particular applicant just not being not going to be a good genetic counselor. I think it's more just wasn't the right time.
Hmm. That's great. I'm sure that almost everyone that applies is probably going to be a great counselor one day. It's just a matter of working out the numbers. So,
Yes.
all right. It might be a little bit of a tricky question, but can you pinpoint what your favorite part of being a counselor is?
Um, so there's a lot of obviously a lot of things I do like about it. I just when I was trying to figure out what I wanted to do with my biology degree and feeling like research wasn't a good fit for me, knowing I didn't really want to be like a a principal investigator and spending a lot of my time, writing for grants and looking for funding. That just wasn't really a good fit for what I wanted to do. Um, I remember thinking back to my high school biology class and learning when I first really got a deep dive into genetics, and just remembering how much I enjoyed learning about all the genetic syndromes, and just it seemed like there was just so much information to be gained from the Human Genome Project, and learning about medical genetic syndromes was just really fascinating to me. And so that is the part about genetic counseling that really attracted me to the field, and just understanding the great diversity of things that are happening. Um, and these things span so many different medical specialties as well. So you kind of have to have a little bit of a knowledge about all different types of specialties. Um, and they all kind of come under one umbrella of a certain genetic syndrome. I just think that's really fascinating. So similarly, working in the cancer clinic, you get to learn about lots of different things all at one time. And I do spend a lot of time with my sessions, not just talking about genetics with patients, but also asking about how their chemotherapy is going, thinking about how they're recovering from their surgery, understanding the journey that even got them into my clinic as well. So I spend I have a little bit of an interest also in the genetics of hereditary endocrine tumor syndromes, which out of all of the genes and syndromes that are associated with hereditary cancer, these are the more rare ones. But they are pretty fascinating because a lot of these types of tumors, they get found incidentally for people, just as they were going to the hospital for another reason, or the patients themselves might have some pretty interesting symptoms that are associated with the hormones that these tumors are releasing. So I just really find these patients interesting to talk with about how they even ended up seeing a genetic counselor in the first place. I tend to have really interesting stories from talking with these people. So yeah, I just think the part about to kind of get to the point of your question, I think the part I like most about this field and what I do is just everybody kind of comes in with a story, and we get to be part of that multidisciplinary team, and really get to the heart of what people are looking for, which is often just an answer or some information that can help them put everything together and make sense of what's been going on. And that's just really rewarding when you can help people kind of put together those pieces.
That's awesome. I mean, I can definitely relate with what you mentioned about trying to figure out what you wanted to do and with not wanting to be a principal investigator and all that because it sometimes it does seem like when you're a biology major, it's like you could be a doctor, you could be like a scientist, and that's kind of what I thought. And when I did some research here for undergrad, I realized that it wasn't really for me either.
Mhm.
So definitely is a great combination. And I think what you said about giving people an answer is probably what a lot of people love to get out of this field. I would imagine that's what I think I'd be pretty excited for because it's definitely fascinating that everyone has genes and everyone has these things contributing to their health, but and it's also I find that it's this thing, especially with um, the prevalence of 23andMe and these other genetic testing and information becoming more prevalent. People have an idea, they think they might know some about it because they have access to these things, but it really is so complex that to be able to be an expert and then serve as a liaison to really educate them on what's happening within their own body or their own cancer or their condition just seems so rewarding. So I can imagine that'd be really, really great.
Yeah, it really is. And I think, we're especially trained in being that liaison and really helping to funnel all of that complex information into something that's very digestible for the lay person, which I think is really cool too. And I find that those skills even help me when I'm working with doctors who do have some complex medical background, but I find that even when I do trainings for nurses and other medical providers, that I feel like we're really effective and we get really good feedback from other healthcare providers, just in our ability to even, teach them about what's been going on.
That is so awesome. And I imagine that has to happen pretty frequently with how much new stuff is constantly being discovered and realized in the field, right?
Yes, you do have to keep up to date with what's been going on. Um, and it's it is really rewarding to help my medical, I so in a cancer institute, it's very common that we serve on what's called like a tumor board. So meetings where for a certain disease type like breast cancer or colon cancer, all of the specialties that are going to be working with these patients meet and they discuss certain cases that have come up, really to have a consensus about the plans moving forward. As I tell my patients, cancer is a team sport, and so I'm just another person on the team. And it's really cool just to be in those meetings and to understand and then give feedback to the rest of the MDs and DOs and surgeons all on the staff there to help them understand the context of what's been going on for this patient, and then to give them insight also about the future and in making that part of the plans moving forward as well. So you really are regarded as an expert on the panel, which is a lot of responsibility, but it's a really rewarding job as well.
That's great. It really is nice to come to provide that expertise on a team like that. I love that dynamic of all working together, and even the most educated oncologist or doctor on your board might not have the specific expertise that you provide. So to all kind of help each other out and fill in your knowledge gap seems really great.
Yeah.
So I guess on the flip side, is there something you think would be the hardest part of your job that you can identify?
Yeah. So, patients are always, I say, like the best and the hardest part of a job because, they're humans and humans themselves are really complicated and they go through a lot of painful things at times as well, especially working in the area of cancer. So, definitely have had cases that really stick with you as far as just a patient and a really with a really devastating diagnosis, or maybe they have family members who that they're really concerned about. I've been in the room when a patient's on hospice and I'm counseling their family members about genetics, and that can obviously be a really overwhelming experience, just emotionally to be present with somebody who's going through something so difficult. Uh, so it always does kind of linger and stick with you. But also I feel like if there's anyone who has that responsibility, I'm glad that I have that, because I know I'm trained in the compassion and also the knowledge that I can give to these people. So I consider it, kind of an honor to be part of that and kind of witness those situations, as difficult as they may be. It's always hard to have to call someone and give them bad news or unexpected news as well. I hope that with my sessions before I test a patient, I've been able to lay some of the groundwork where they feel like they can trust me, they can lean on me for information and for support, and to also give them some guidance about the possibility of what may come and try to anticipate the questions or concerns that they might have. So that when results do come out, even if they are not ones that the patient was really hoping to have, they at least feel like they're going to be able to manage this and get through it. So if I'm doing my job right, often even a quote unquote, bad news is always news that can still be, the patient can still feel like that they can move forward with. So yeah, the giving out bad news and just being with patients in a really difficult situation is obviously a hard part of the job, as well. But I do give out a lot more good news than bad news, I do say.
I can imagine that would be tough. I mean, I'm wondering, like, how well do you think you were prepared for that from your clinical rotations? Because I'm imagining you would have run into some of that along the way, right?
Yes. So as a student, I know I was not the one to give out a lot of this news, but I was really there to be a witness, to see my genetic counseling supervisors deliver that news, or to be with the patients in these difficult situations. So really just, having a model for me, what to expect. But sometimes you really don't know until you're in that situation how you're going to handle it. So I think we need to practice just, keeping our composure, understanding how to be present with a person, and then also on the back end, once the situation has passed, for ourselves, how to take care of our own reactions to the situation. Being able to debrief with one of our colleagues, or just have some self-care on our own too, I think is really, really important to staying resilient when you're dealing with these difficult situations. So I think the programs try to at least give you some of those building blocks, so that way when you are in that position, you don't panic. You're ready to just jump in and do what you need to do in the moment.
That definitely seems, something that you have to acclimate to a little bit. But
Mhm.
I imagine the network of your colleagues would be a really great support, because they fully can empathize with how difficult it is they've had to do it themselves in the past, and you guys can all kind of lean on each other.
Yeah, absolutely. I feel really lucky that when I started in this position, I had a couple other colleagues that I saw as mentors and used them for guidance. And now that I've been in the field for 5 years, we have our team that's much bigger now. I also can provide that mentorship to other newer counselors as well. So we're all there to support each other.
That's awesome. And the last thing I was wondering is, what would be one piece of advice that you would give yourself, your younger self, when you were applying to genetic counseling school / just starting out?
Yeah, I was trying to think about this. It's tricky. But I think I would just try to give myself really just some grace. I think it's such a stressful time. You're trying to figure out what you want to do, and you feel like you're on this strict timeline of trying to get things accomplished. And obviously, getting into school is a really high pressure situation. I think I would have just given myself some more grace and some patience, and try not to be so hard on myself as I was studying for my GREs, or taking extra classes, and know that I think to be most prepared, and what I look for even in an applicant when they're applying for school, is really just the maturity that they have about the field, and where they see themselves fitting into the career as well. It's not always going to be the person with the highest grades or the highest scores or the most number of genetic counselors that they've shadowed. Really, I think it's better just to take a step back and get to know yourself and understand why you think you'd be a good fit. So I think that was something I was maybe lacking when I was applying. And now that I'm out of it on the other end of things, I think I'm really grateful that I had some extra time and extra years to really mature and understand, why I liked this field so much.
That's great advice. I definitely have some of those feelings myself right now. I'm about to be a senior, so I'm trying to get everything in line going into that year and making sure I'm on top of everything. So,
Mhm.
um, yeah, that's great advice. I appreciate that.
Yeah.
Well, I think that's all I had for you for now. I really appreciate you taking the time to talk today. It's been very helpful, very good perspectives that I now have.
Absolutely. And good luck to you and all of your plans. I know it's probably not the best way to go out from your college experience with the way the world is right now. But I really wish you guys a lot of luck, and I think you guys are really resilient for sticking it out through all of this. I think it's going to really show as you guys move forward.
Thank you. I appreciate that a lot.
All right.
All right. Have a
Thanks,
great rest of
Ethan.
your day.
Take care.
Bye. All right. So that was another interview with a practicing genetic counselor. I hope there were some good insights in there for you. And stay posted because I have another one coming out very shortly and more on the way after that. Have a good one.